ulcers are common among the 30 million Americans suffering from diabetes, and according to the Centers for Disease Control, are the main cause for 85% of lower limb amputations, with the future incidence of diabetes projected to rise to over, listen to this, 500 million people worldwide over the next decade. The need for improved screening and earlier intervention in diabetic foot disease is clearly evident here. Joining us today with more on this subject is board-certified podiatric surgeon Dr. Lance Berlin from Islip, New York. Doctor, first let's talk about what causes the lower limb problems in people with diabetes.
So the two major factors that affect diabetics are peripheral neuropathy and peripheral arterial disease. That 1-2 punch is what causes the vast majority of all problems. When you don't have good perfusion or good blood flow to the tissue on the bottom of the foot or anywhere on the leg, and you add to that neuropathy where you have a loss of feeling where people can't tell that they're actually having a problem, those two factors allow small problems to develop into much bigger problems.
Oh my goodness. Explain what a wound needs to heal, doctor.
So the most important thing a wound needs to heal is adequate blood flow, good tissue perfusion. Oxygenated blood needs to get down to the bottom of the foot to heal those wounds.
Now, when you have a patient obviously come in with this issue, how do you treat them? Are there tests that you perform?
Currently, the standard of care is ankle brachial indexes. There are some other tests that are dependent on blood pressure cuffs and putting probes on the skin, but sometimes these are user dependent, technical dependent, or because of something called stenotic vessels or calcified vessels, the tests with the blood pressure cuffs aren't always as accurate.
So definitely there is a need for improved imaging technology, and that's where HyperView comes in. How has this changed, I guess, the lives of many patients?
Right, so this is pretty impressive new technology that I've been using in the office since May of this year. I use this in two basic ways. One is as a screening tool to see if I have a patient that's high risk based on my findings from my clinical exam and other testing that we may have done. The other one is to use it on patients that already have or have had an ulceration. We could actually look at how that actual perfusion is to that specific tissue. What this allows you to do is to instantly evaluate a patient's circulation. It's basically a point-and-click spectral camera that you could evaluate any portion on the lower limb, how that tissue perfusion, or how that blood flow is to that exact spot that you want to evaluate.
So it's a lot easier for you, the patient. You just take a picture and you have all the information that you need in how long?
Second.
Wow, that's fantastic.
Click the button and you'll get an image directly on the screen, and there's numerical data that will come up, and then you can evaluate that data to say whether or not that person has enough oxygenated blood, deoxygenated blood, or the O2 saturation level to that tissue.
Which is basically looking at the circulation.
Exactly what it's doing.
Fantastic. So doctor, can you explain how this information helps you then assess the next steps in care?
Yes, so the data that we're getting back from the HyperView system gives me imaging and numerical data. From that data, I could then make a decision on whether or not a wound may heal. I can also look at the numbers and say, you know what, my oxygenation or my deoxygenation or my saturation levels are too low. And from that data, I could then say, you know what, I need to get this patient more help, and I could refer them out to a vascular specialist.
Fantastic stuff. In fact, the HyperView can also be helpful for the vascular interventional specialist. The Balancing Act caught up with Dr. Pratik Gupta, a vascular surgery specialist in Memphis, Tennessee. Take a look.
So the first stage where we use HyperView is in the clinic setting. When somebody comes in and I suspect that he or she may have peripheral arterial disease, we will use the HyperView to actually take a snapshot of the foot to see how much oxygenated blood is getting to that area. If it is not enough, if it is subnormal, that basically means there is some blockage somewhere. At that point, we could either lead with a confirmatory test or directly take the patient for an intervention. So usually there are two ways to fix it. I try mostly the less invasive way, and that is we put stents, balloons, remove the plaque. That's the less invasive way. Now the more invasive is to do an open bypass, and sometimes that's what you require because the blockage is too extensive, and then we do an open bypass surgery. And the last step is obviously amputation if nothing else can be done. If patients come in an earlier stage, the treatments are simpler and the patient relief and satisfaction is a lot more. So I definitely think incorporating this into screening tools, screening guidelines would save a lot of patients.
Doctor, this is really amazing, and so much progress being made, and so many people benefiting from it, right?
Correct. And with this new technology, we'll be able to help save limbs, prevent amputations, hopefully prevent ulcerations and, expensive medical treatment in the hospitals.
Fantastic. Thank you so much for coming in and sharing this great information and this great new technology.
Thank you.
Appreciate your time. And for more information on the HyperView imaging system, just visit this website. It's really easy, hypermed.com. That's hypermed.com. Or you could go to our website, thebalancingAct.com.